The coronavirus pandemic has quickly infected many countries across the globe. Following the suggestions or policies enacted by governments, most people are beginning to quarantine themselves in the hopes of slowing the spread of the coronavirus. Most people, with the exception of essential workers, such as police officers, firefighters, and medical personnel. Dr. Fatima Waqar, a resident doctor at the Multicare Medical Center in the Bronx, New York, explains what the front lines of the crisis is like.
Most programs in New York have switched to a 7 day on and a 7 day off schedule where you're doing 12-hour shifts on the 7 days that you're on, and then the other 7 days the next week you're on backup. So that means that if anyone calls in sick, they can call you to work. And so these are 12-hour shifts from 7 a.m. to 7 p.m. for the day shift, and then 7 p.m. to 7 a.m. for the night shift.
Dr. Waqar says that, considering the circumstances, it has been necessary to promote interns and recruit other medical professionals to keep up with the influx of patients.
Our interns have been promoted to work as residents with almost minimal supervision. So I think this is something that I'm really proud of them, that they're doing a good job, that they've taken care of their own teams, they're leading them. Of course, we're always there to help them being the senior residents. But otherwise, interns until the end of the first year, which usually ends on the 30th of June, they're always supervised by residents. They never get to, be in charge of their own teams. But given the circumstances, they've been promoted to become, as the term has been given, as resiturns, which means that they're functioning as residents. And they're doing a good job in that because, they've been given responsibility a little earlier than they would have in July, but they're really, doing it really well.
Although the situation has improved at the Multicare Medical Center in terms of PPE or personal protective equipment for those staffing the hospital, medical practitioners have had to revise their usage to meet higher demand.
Before this pandemic started, we had plenty of masks. We would use one for every patient, discard it. But now, just as we enter our shift, we're given like this little bag of PPE, which has one N95 mask and two surgical or regular masks. And then we have to use the surgical masks for the whole shift. We have to save that mask. Um, but we do get the N95 every day, a new one. We do return it at the end of the shift, and it's recycled or reused. Um, we have enough gowns, so I think our hospital is doing better in PPE than it was when the pandemic began, and it was all of a sudden the large influx of patients, and then we fell short of masks. We didn't have them at all. We didn't have gowns. We'd have to hold on to one gown for the whole day. But now that the things have improved. But even with the improved situation, we're reusing our surgical masks, which we would not normally do.
Dr. Waqar explains that there is high exposure to viral materials while working at the Multicare Medical Center, and that she risks bringing the virus home with her after every shift.
When I did 2 weeks in the ER, the people in the ER who are actually the front line, the very first contact of these patients, who triage them, and the moment they enter, they're definitely posing a risk. Although we're all now, like I said, we have better PPE, so um, we keep ourselves protected. But even in the situation, um, you can still have a chance, because the first minute that you're coming in contact with the patient, you don't know what he's here for. And I personally, definitely, when I come home, I have to head straight to the shower. I do bring my scrubs home. um, have to wash them with, in the same laundry as the rest of my clothes. So I think no matter how careful I am, we as physicians or healthcare workers, we're exposed to very high amounts of viral load of this virus, COVID. and we're definitely bringing some to our homes as well.
Unless you are in need of immediate medical attention, the best thing to do is to stay home to help minimize the spread of the virus.
Yep. So should just stay at home, and just go out as just for groceries or medicines, or unless it is very, very necessary. Just stay at home, isolate yourself. Even if you're having mild symptoms, there's nothing that we're gonna do different. Um, should still stay home, check your temperature, and just because the main treatment is just supportive care. So if you're just because 80% of the population is going to have a mild form of the disease for which you don't even need to come to the hospital. What you need to do is just isolate yourself, and just supportive care. Um, of course, if you're at the point where, God forbid, you develop some difficulty breathing, or your chest starts hurting really bad, definitely you need to seek medical attention. But before that, you have minor symptoms, you don't really need to come to the ER to get yourself tested, because that's just you're going to expose yourself to more people, you're going to cause more spread. So just, minimize your exposure, stay home, and make sure you're eating a healthy diet and boosting your immunity. That's the best thing to do.
Reporting for Hawk TV, I'm Ayman Yasin.